Let's begin by talking about plaque. Plaque is a sticky film substance that contains bacteria and sticks to our teeth surfaces. Whenever this biofilm accumulation is left on our teeth for long periods of time, it becomes calcified and hardens onto our teeth, usually going unnoticed as a colorless film until it hardens into plaque. When bacteria goes long periods of time without being disturbed and the bacteria continues to stick to the tooth surfaces and gums, the accumulation eventually hardens into calculus. The visible accumulation can happen supragingival, meaning above the gum line, or subgingival, meaning below the gum line. Calculus buildup can be mechanically removed during a regular dental cleaning visit. Now let's move on and talk about tooth decay. Tooth decay, sometimes called cavities or caries, are caused by a combination of factors. Bacteria in the mouth, frequent snacking, or sipping on sugary drinks are all causes that can permanently damage the hard surface of our tooth. If plaque is not washed away by saliva or brushing, the environment in our mouth becomes acidic and cavities start to form as a result. A neutral pH of the mouth is 7. When the pH of plaque drops below normal or less than 5.5, the acidity starts to dissolve minerals and destroys the tooth enamel. As a result, small holes of erosion will form. Over time, they will become larger until a large hole or cavity appears. Sugar tends to attract bad bacteria. The two destructive bacteria found in the mouth are Streptococcus mutans and Streptococcus cerebrinus. Both feed on the sugars we eat and form dental plaque. The good news is there are a few ways to prevent decay. Brushing with a toothpaste that contains fluoride, dental sealants as a form of preventative care, receiving fluoride from tap water, rinsing and cleansing the mouth of any food debris, keeping up with your regular dental visits, and considering your options of different fluoride treatments are all great ways that can help prevent decay. A big factor of preventing tooth decay is our diet. It is important that we avoid the consumption of certain foods and drinks that cling onto our teeth for long periods of time. Acidic and sugary foods, along with carbs and starch, are all more likely to cause decay than the foods that are more easily washed away by saliva. These are typically foods that we want to try to avoid since they are more likely to cling onto the tooth surface. Now that we've talked about plaque, let's go over gingivitis. Gingivitis is a form of gum disease that happens when plaque, a naturally occurring sticky film containing bacteria, builds up on the teeth and causes inflammation of the surrounding gum tissue. Plaque produces toxins that irritate the gums, make them red, puffy, and cause them to bleed. Some symptoms of gingivitis are swollen gums, gums that easily bleed, puffiness, receding gum line, and tenderness. There are multiple factors that can cause gingivitis. Smoking being at the top of the list as one of the greatest risk factors associated with gum disease. Smokers are more likely to suffer from gum disease than people who don't smoke. Poor oral hygiene or not fully removing plaque. You may be missing the plaque found around the gum line. It is important that when you brush, you also cleanse the gums. Stress is also on the list. Stress can weaken your immune system and negatively impact your ability to fight infection, including gum disease. Hormonal changes, including puberty, pregnancy, and menopause. It is important to take extra care of your teeth and gums during these physiological changes to prevent gum disease. Poor nutrition deprives the body of important nutrients and makes it more difficult for the body to fight infection, including gum disease. Medications can also have adverse effects in the oral cavity, with dry mouth being one of the most common side effects. Many chronic diseases such as diabetes, cancer, and HIV impair the body's ability to fight infection and can cause gingivitis. Preventing and controlling gingivitis. By practicing good oral hygiene habits such as cleansing your gums by brushing twice a day, flossing, making sure that you get that floss below the gum line, and keeping up with your regular dental visits are all great ways to prevent the development of gingivitis. So what happens if gingivitis is left untreated? Well, it is important to remember that gum disease happens in stages. Gingivitis is the first type of gum disease we encounter, which can cause the gums to feel pain, severe bleeding, and swelling. The disease is still reversible at this stage and can usually be eliminated by careful daily brushing and flossing. If left untreated, gingivitis progresses into bone loss and teeth can be in danger of falling out. This stage is called periodontitis.